Nearly 1 million Ohioans are eligible for the COVID-19 vaccine under the state's latest phase in the rollout, but some people with life-threatening medical conditions are still not on that list.
News 5's Emily Hamilton explains why cancer patients under the age of 60 were left out and what's being done to get the governor to include them.
Beginning Thursday, people living with type 1 diabetes or Lou Gehrig's disease, bone marrow transplant recipients, and pregnant women are all eligible for a shot in the arm. But an entire population of critically ill patients in Ohio were left off that list.
Governor DeWine's not giving cancer patients that option.
We've had many cancer patients and survivors reach out to the society in recent days with questions and with confusion.
On Monday, the Ohio Department of Health remained firm in its stance that cancer patients have been excluded because, quote, the number one risk for mortality from COVID-19 is related to age.
Many of the medical conditions that are not currently on our list of medical conditions are ones that are much more common as we get older.
But Brian Hannon of the American Cancer Society says it's imperative that cancer patients are added to that list, regardless of age.
We also know cancer doesn't discriminate on age. There are childhood cancer patients. There are people who are diagnosed with cancer at any age and in any stage of life.
Brittany Hinkle's mother died of cancer when she was only 52 years old.
Every woman in our family has passed away of cancer.
Now Brittany's sister Jenna is battling the disease, ineligible for the vaccine because of her age.
Because she's young and is sick, she's not allowed. If she wanted to get the vaccination because she makes her feel safe and makes her family feel safer, she feels like she should be allowed to.
And Barb Diver, a nearly 30-year cancer survivor, knows cancer diagnoses can come long before the age of 60 after being diagnosed in her early 30s.
I just became eligible age-wise on Thursday.
Patients, survivors, and their relatives, along with Ohio's American Cancer Society chapter, are pleading with state officials.
I think this is more about educating the governor and his team about why COVID-19 poses such a threat to cancer patients and why this vaccine is so important for patients.
To get these vulnerable patients in line for inoculation.
The last thing that I think she wants is to get COVID. She wants to be able to protect herself as much as she can from COVID.
Emily Hamilton, News 5.